Well, hello everyone. My name is Jennifer James. I am the founder of Bloggers for Social Good. I am really excited to introduce this next panel. The Global Mom Relay supported 4 global health campaigns, each with a specific solution to improve the health of mothers and children worldwide. Here to discuss these solutions are Radha Muthiah from the Global Alliance for Clean Cook Stoves. Also here is Patty Michelle from the M-Health Alliance, as well as Nina Schwalbe from the Gavi Alliance. And leading this critical discussion is Lisa Belkin from the Huffington Post, so please give them a round of applause.
Good almost afternoon. So the challenge in subjects like this, challenge for me in covering them, the challenge in confronting them, is that you have large, sweeping, global issues, and yet the best way often to deal with them is one facet and one person at a time. And it strikes me that that is what all of you do, that you take the large and you bring it down to the one, the big to the small. So that's the theme, in a way, that runs through what you do and what we're going to be talking about today. I want to start, though, with you. So start with the personal, speaking of the individual and the small. You're all mothers. How has that influenced what it is you're doing, and how has it changed how you perceive your mission, your goal?
Sure, I'm happy to start. I grew up in Malaysia and then came to the States for college and later. And what was apparent to me, living in Malaysia, visiting my relatives in India, was that women didn't have as much choice as I thought they really needed to. And so really engaging in something that helped women have that choice so that they could make decisions on what they wanted to do with their time was important. And so in my career, I've worked in general women's empowerment, now in the cook stoves area. And I find that for cook stoves, today, women spend a vast majority of the hours of a day collecting their fuel, cooking very inefficiently, and if they had something more efficient to work with, more accessible, then it just gives them that much more time to be able to, think through what their choices are, spend time with their families, work, etc. So that's really how I came to engage in this particular field.
Great, and probably as the newest mom on the stage,
Yes.
my little one Gabriel just celebrated his first birthday on Sunday. My husband and I feel like we should get an award for keeping him alive for a year. But a lot of my work in working with moms and children began very early on in my career. I was probably in my early 20s working in Egypt, and one of the biggest challenges that pregnant women and new mothers faced was access to communications, access to transportation, and access to health services, as well as the power to make decisions about their own health and lives. And mobile technologies, as many of you know, we now have over 6 billion cell phones in the world in a population of 7 billion people. And it's an amazing opportunity to leverage a technology that is really transforming the world. And it's been in the course of the last year that my whole take on maternal and child health has completely transformed just from my own experience as a mom and really interacting with time-based information through platforms like Baby Center, et cetera, that have really helped me to really be a better mom in general. Nina.
Great, thanks, and I'm really happy to be here in Tribeca. I'm a Tribeca mom. I had my 2 kids here. I'm from New York City, and really pleased to be asked here to speak also by one of my mom heroes, Anu Gupta, who's with J&J, and she's one of those moms that you bond with along your path at work and really support each other along the way. So thanks to her. And the UN Foundation and J&J for putting this together. I'm part of a two-mom family, so we are moms, Moms Plus, and we have two boys, Milo and Sai, who are 8 and 9 years old. And for us, birthing the boys here in New York City and in Tribeca, vaccines was an option that we had. And for us, it was a no-brainer, a way to give our kids shots to protect them for life against diseases which kill. And I think I've been working in international health since I graduated from college, so for almost 25 years now. And kids who grow up in poor countries don't have access to those vaccines, and it's such a simple solution. It's a shot that can save lives. And so for me, just realizing the inequity and the fact that and I know that not everybody in the U.S. has access to health care, but a lot of us do, and a lot of people do in the richer countries. So for me, it was really motivating to think there are a lot of simple technologies and solutions that are really easy to provide to kids and can save lives now.
So Radha, let me start with you. So speaking of the universal to the specific, if you will, we spend a lot of time dealing with the large global sweeping issue of malnutrition or of sometimes overnutrition. But what your work made me focus on for the first time was specifically the effect on a family of how food is prepared, and which I find fascinating and frankly counterintuitive. It did not occur to me that there was that big a change in a family's life. So tell me, what is it you do and what difference does it make?
I think the best way to put this in perspective is to give you sort of a story, sort of a typical day, and how the food preparation, if you will, in a household, what's involved in that. And in many parts of the world, it differs slightly, but there's a common story. And essentially, it involves a woman, often her daughter, getting up at 4:30 in the morning and heading out to collect fuel. So firewood, collecting animal waste, etc., is the fuel that vast majority of people in rural areas use as their cooking fuel. And so you walk a few hours, and increasingly that's getting to be, not just 2 hours, but 3 hours and 4 hours because of degradation of forests, because of the, chopping down of wood to be used for fuel. So you've got that trek every morning, often in the dark, and so there's, they themselves are at personal risk and vulnerability as they go out to get their fuel. You come back, then it's either a 3-stone fire or a fairly rudimentary stove, and, to get that heated up and to, get it to a temperature where you can start cooking your meal, and breakfast in many parts of the world is a substantial meal. People go off to work after that for the entire day. And so that whole process can just take hours, and then you're preparing for dinner, etc., that evening. The other thing, so one is the time, the opportunity cost of time and the safety that women and girls often face. The other issue is one that of burns and safety within the household. So, you've got a pot that's precariously balanced on this 3-stone fire, you've got kids running around, and we've actually seen high incidence rates of burns that are related to kitchen-related accidents. So that's another issue, related to that as well. And of course, I talked about some of the environmental issues. So what are we as an alliance doing about this? One is we're taking a fairly unique approach, which is a market-based approach to addressing this problem. So we've seen some of the traditional aid not work as well in the past in terms of handing out stoves to individuals. So we're trying to develop a market for clean cook stoves. And that's everywhere from, developing standards for these stoves to building capacity of small-scale enterprises, often women-led enterprises, supporting women be a part of that value chain, selling stoves, providing the after-sales service for these stoves as well. So if you think of the Avon model or something like that, that's very much what we're trying to do in many of the countries around the world. So see women not just as users and consumers, but also a very active part of the process of developing this market as well.
Okay, so Patty, your large sweeping issue is maternal health, pregnancy, birth, and the smaller solution is a cell phone?
Well, and it's not a small solution, actually. It's a big solution. I mean, it's quite amazing just to see the proliferation of cell phones, and even over the course of the last 10 years, just how access to mobile phones has increased tremendously, to the extent that you talk to most ministers of health, and in their top 5 priorities, mobile health and or telemedicine factor in very strongly. So they're looking for ways to extend much needed services to people in remote settings that they couldn't reach before.
So give me an example.
So for example, I just came back from a trip to Nigeria, and I was in a rural area and for an antenatal care clinic. And during the clinic, I sort of ran a little focus group and asked the women, how many women in that audience had access to a cell phone? And the majority of them lifted their hands with a cell phone in their hand. And then I continued to ask them questions about the way that they were using their cell phones to access health information. And a lot of them raised their hands to say, yes, like I talked to my mother, or I talked to my healthcare provider to ask them questions about what was happening with my health, or I used the phone to get access to transportation to take me to the health facility. And then you talk to the health workers themselves as well, and mobile technologies are now being used increasingly to support the health workers so that they have the information that they need when they need the information, or that they have the supplies that they need in the case of vaccines and other life-saving commodities when and where they need it. And so it's really like a story about empowerment, that women are now feeling increasingly empowered through mobile technology. Health workers are increasingly feeling empowered through technology, and even governments themselves looking at the sort of state of the health system, that you can actually strengthen a health system through a more strategic use of mobile phones.
And what's the next step? In other words, is there content that we can now provide that will enhance this?
Sure. So the mHealth Alliance, a lot of the work that we do is really focused on supporting the enabling environment as well as demonstrating the impact that mobile technology can have. And so we have a number of initiatives that we're working with, including the Mobile Alliance for Maternal Action, which is really looking at bringing to scale mobile information services for pregnant women, similar to what many of you have probably used here in the United States, the service that Baby Center provides. But it's time-based and stage-based messaging so that women can take better care of themselves, can take better care of their children, can detect risk factors in a more timely fashion, and get the care that they need when they need it. And then we also support a catalytic grants program to look at how do we start to scale up. People talk about the proliferation of pilots within the mHealth space, and there are a lot of pilots, but I think you need to have pilots to really learn what works, what doesn't work, and then take the things that are working and really start to scale them so that we can leverage this sort of newfound access that the majority of the population of the world now has to a tool that can save lives or improve the quality of life that they have.
So Nina, the idea of we know what works and doesn't work. So vaccines, we know what works, and yet. So what are the obstacles and what are the ways to overcome them? How do we get something, we know what the tool is. What's getting in the way?
Right now, developing countries and the countries, Gavi works in over 70 countries, the poorest countries of the world, and it's in those countries that we still have over 1 million children dying from vaccine-preventable diseases. That's 1 million kids dying, where if they had vaccines, they wouldn't die. I think what's exciting is that as these vaccines become available to us in the richer parts of the world, organizations like Gavi, through support from groups like Shot at Life, are able to roll these vaccines out quickly. The uptake of these vaccines is like wildfire. Countries want them, they want to deliver them. The obstacles are pretty technical. The obstacles, for example, on delivering vaccines are that vaccines need to stay cold. So people talk a lot about Coca-Cola getting anywhere in the world. The problem with vaccines is that, Coca-Cola you can take out of the fridge and put it in the fridge and take out of the fridge. But with vaccines, we need to make sure that the vaccines stay cold all the way along the delivery chain so that by the time they reach the arm of the kid, they're still effective. So one of the challenges that we face right now is making sure that countries have cold chain systems to deliver the vaccine. And another is the healthcare system and making sure that we're taking advantages of all opportunities to make sure that moms reach the healthcare systems and that the healthcare systems can reach the moms. But the progress has been incredible, whereas it used to take 20 years for vaccines developed and deployed here in the United States to reach developing countries. Now we're delivering vaccines in less than a year after they've been introduced in the US. So Gavi, for example, now is we're reaching 50 million children a year with vaccines. And as we get great new vaccines along, the idea is to continue to reach those children with all the vaccines that can help them lead a healthy life.
Now, can you do this without the involvement of government? What is the intersection?
The involvement of government is critical. We believe at Gavi that vaccines is government business and that governments must absolutely, as part of their commitment to equity and contribution to health as a human right, provide every single child with vaccines. Globally right now, about 1 in 5 children are not being reached with vaccines at all. So part of the Gavi model is that we work with and through governments to reach every child. And it's not traditional aid, as you were also talking about. Countries copay. Countries provide a portion of the vaccine costs that we give to show that they have some skin in the game, that they're taking responsibility for their population, and they care seriously. So we work with ministries of finance as well as ministries of health to look at the economic benefits of these vaccines and encourage them to invest. I read a recent study on the plane. I live in Geneva, and plane rides are a really great time to read, and especially when you have kids. It's concentrated time to read. But I read a recent study in the US that said that for every dollar invested in vaccines by the US government, they save $5 in healthcare costs. So it's working with governments in developing and poor countries to show that vaccines, not only do they work, but they're a really cost-effective intervention. They free time. Kids don't get sick. They go to school. They learn better. Moms don't have to stay at home with their sick kids. So the benefits are really almost countless.
Is there the same pushback and controversy other places in the world that we are seeing here for reasons we don't need to get into at the moment? But are you seeing that elsewhere?
Unfortunately, we are, and a lot of it is actually being generated from here. And by lobbying and advocacy groups from here. And it's really a problem because whereas if my kid gets diarrhea or severe diarrhea or pneumonia, it's serious, but I can bring them to the hospital and they can be treated if they get antibiotics, if they're properly diagnosed. And as we all know, in poor countries, if your kid gets diagnosis or diarrhea, that is essentially a death sentence. So it's really a worry for all of us, and I'm hoping that some of the mommy bloggers out there can help us really stand up together, a million moms, and say vaccines work. Every child deserves them. This is a human right, and the best way we have to save children's lives.
Government is. Just wanted to make that point. Government is a partner as well, I assume. In other words, that's another way of looking at this as small nonprofit initiative, but part of a larger whole. How much energy, effort is spent with negotiation and interaction with the governments of the countries that you're working in?
A significant amount. So the M Health Alliance, we're an alliance, and the way we see it is that you need everyone rallying around the more strategic use of cell phone technology. So, we work with ministries of health and ministries of technology to help support the enabling environment. So a lot of the private sector is less inclined to invest in mobile health if they see high risk of investing. And, and health is a serious subject. There's a lot of, liability issues and things like that in the delivery of health services. And so we see the real need for driving public-private partnerships as well as, ensuring that a lot of the, smaller NGOs and larger NGOs are starting to engage in leveraging the technology and helping governments to be a lot more strategic in saying, okay, here are the targets that I've set for myself in terms of providing health services to a population, and here's where mobile technology can have an impact, and here's what needs to happen in terms of really making it work, and the role that each player has to play. And there's a really strong role for government to lead the charge, as well as for the private sector to invest along with the larger global health community to really mobilize and lend its support in this.
And that sort of that partnership, if you will, is really critical. And I think you probably see that across all of our work, and as well as increasingly other areas in international development as well, because there's a role that only government can play, and especially when it gets to scaling up and trying to have universal coverage, whether it's for immunizations or health or for cook stoves. So there's several things they can do, whether it's from public awareness messaging, and sort of using their own infrastructure, whether it's health or otherwise, to get all the way down to villages and most remote areas as well as to take some of the pilots that are working, and being able to kind of translate that more broadly as well. And from a market-based approach, there are definitely things that the government can do to encourage a more enterprise-friendly environment within their countries, whether it's from a large multinational perspective, inviting foreign direct investment, to just encouraging the growth of small, medium-sized enterprises within their country. So there's a very active role that governments can play, but it's sort of helping them understand where they play and where some of the other actors, private and NGO, can.
Okay, and then what's the role of us? I mean, we have a room full of people physically here. We have people who are out there, all of whom are, individual actors in a larger network and literally web. So what's the message to them? What are we supposed to be doing?
I would say helping us get the message out, even further. There, you have, unique abilities and different channels of getting this message out. I think from a cooking perspective, it's actually the 4th largest killer in the world. So you've got 4 million deaths a year that result from, exposure to this cook stove smoke. I'm sure many of you are not as aware of that. I wasn't as aware of that, just a few years ago as well. So I think getting the message out, in various ways is important. And I think making the connection, sort of mothers here, when you're cooking a meal, you're thinking that that's providing nutrition, supporting the growth of your kids and family, whereas it's a very different story from mothers in other parts of the world as well as they cook their meals. So I think just getting the word out and being able to support the effort in raising awareness is critical.
Any other messages you want to end on?
Well, I would just say, think about how mobile technologies have changed your own life, and or your own role as a mom or as a part of society, and then think about how for many of the women and families around the world that might be their only connection to information or their only way of communicating outside of their home. It's a really powerful tool, and so my encouragement is to me it's common sense, but I've been working on this for a really long time. But take a moment and then think about what you can do to help really advocate for increased support for programs that leverage mobile technology in a much more systematic and strategic way, so that we can prevent the death of the 800 pregnant women that die every day, and the million children that die, or the millions of children that die every year.
Nina, I'll give you the last word.
Thank you. I have 2 messages, one from me and one from my kids. And the one from me is that tomorrow we're going to be launching a very exciting new initiative. So ask you to watch the space, and it's about rollout of a vaccine against cervical cancer, a vaccine that women in this country have access to, a disease that kills a woman every 2 minutes, and most of them live in developing countries. So watch the press, watch the news, watch the space tomorrow. And then I have a message from my children, which I had to write down. And I asked them, Milo and Sai, what message they would want to give to the people sitting here. And they said, vaccinations keep kids healthy. Tell all the moms to make sure to get their kids vaccinated and offer them a healthy life. Thank you.
Thank you. Thank you.